So Mark here has a lot of hip and low back issues. It wasn't very painful, but very stiff, you know, when he first came to us.
Very stiff.
And his gait, the length of his gait, or the stride, was somewhat diminished. Now you can see he's walking pretty well, you know.
And I had a bad limp.
And he did have a bad limp, you know. I mean, we can't really put him out in a marathon right now yet, but he's walking much better. So today we're going to show you what we do to try to basically mobilize the hips, adjust the hips, and also adjust the low back to try to get some more mobility in patients that have a lot of arthritis in the hips and also have a lot of arthritis in the low back. So first thing we have you do with Mark is go face up for me, sir. With your head this way, your feet this way, on your back. With Gulf Shore Chiropractic, you know, we do a lot of myofascial and soft tissue release for our patients, but particularly in the hips and the low back region, we do a lot of stretching and a lot of, again, soft tissue. I call it soft tissue mobilization, but it's basically a whole bunch of different techniques that have accumulated over the years to help to mobilize the patients as much as we can. So when we do adjust them, the adjustments hold much better, especially in the weight-bearing joints like the low back and the hips. So first thing we have Mark do is to just do a basic hip flexion. And the reason we do this here, it opens up the attachment of the hamstrings right in the glutes area. And Mark did have a couple, or at least one major surgery when you were young, Mark, right? In your hip area?
No, I had a car accident.
Car accident.
The car
Okay.
hit me in my hip.
In your hip. And how long ago was that, Mark?
Oh,
That was years ago, right?
45 years ago.
45 years ago. So, so when he was a young, strapping young man, you know,
Very young.
very young, he had some struggle with the hip area. So now, you know, some of that is showing up slowly but surely, and so as you can see, you know, he's still walking pretty well, and that's pretty normal with our joints. You know, as we get older, they do get stiff, but even with prolonged or a chronic you know, condition like Mark had, you can still do a lot of stuff for it if you know what to do to mobilize the joints and mobilize the soft tissue. So
When I started to come to Gulf Shore, I could not golf, and now I golf twice a week, every week.
every week, that's pretty good. So we'll take that. Go ahead and resist downward for me, Mark, and relax for me, sir. I'm gonna bring it up just a little further on you. Good. Go ahead and push down for me, Mark, and relax me. This is pretty advanced stretch right there. A lot of people really don't do this for their patients or a lot of therapists, but you're starting to see that more in the sporting arena now. If you watch football, and the trainers are starting to do this here, where they actually are having patients resist and push, and it's the term of what we call is PFS, post facilitation stretch. Push down for me, Mark, and relax for me. We've been doing this since 15 years ago, but trainers and stuff like that are starting to catch up. Usually they just do some static stretches by just having patient go up and go as far as they can, and that's it. But now you watch the football games closely, a lot of them are doing what we have been doing for years, which is trying to have patient resist downward. And what that does, it actually enhance the patient joints and muscles, so we can get more movement with the stretches that we're doing on him. Go ahead and resist down for me, Mark. And relax for me, sir. Good. Push down for me, Mark. And let go for me, sir. Good. One more time, Mark. And relax for me, sir. And yeah, as you can see, that's pretty good. I'm pretty happy when we can get Mark to go vertical on me, which is like that. So, all right, we're gonna do the same thing here. Bring this all the way up for me, Mark. Bend your knee for me, sir. And we're gonna bring all the way up to your abdomen. Good. Again. Go ahead, push up for me, sir. And relax for me, Mark. Good. Push up for me, please. And relax for me, Mark. Good. Nice job. And then we're gonna bring this all the way up. This time we're going to rotate it just slightly on a different angle with Mark on this right hip of his there. Go ahead and resist downward for me. And relax me, Mark. The key with all these stretches we're doing on Mark here, or any patient, is trying to find the area that has the most resistance. Resist downward for me. And relax me, Mark. Nice job, sir. And it's pretty, I mean, this is pretty hard work for the patient themselves too, you know, so, because they, not only are they in pain, but they don't have the flexibility with that stretch. And we're trying to make them go towards the area where they're not comfortable with, right, Mark?
That's correct.
Push downward for me, sir. And relax me, Mark. Good. Keep going, sir. And relax me, Mark. Nice job. You did great, Mark. We'll lock the knee and see how far we can bring this one up on you. Go ahead and push down for me, Mark. And relax me, sir. And one more time, right there. Nice job, Mark. Good. So that's some of the stretches that we actually do for Mark to try to help to mobilize the hip more, and this really has been helping him to walk and be on his feet and have more balance in the